All right, welcome back to AI for 2021 Healthcare Summit. Our next talk is titled Operationalizing AI Fairness in Healthcare, a case study from Humana. We have two speakers from Humana that are going to be presenting this today, and this talk is sponsored by Arthur. Please join me in welcoming our panelists to the virtual stage.
Great, thank you so much, Patricia. My name is Brian Powers. I'm the Deputy Chief Medical Officer at Humana, along with my colleague, Brent Sundheimer, Principal AI Architect, who will be speaking with you today as part of this great forum. So really pleasure to be here, and thanks so much for having us. Brent and I today are going to talk about operationalizing AI fairness in a healthcare setting, talking through some of the work that we're doing here at Humana. Just to provide a little context for those of you who don't know too much about Humana and know where we're coming from in this journey. So Humana is a national health and well-being company. We serve millions of Americans. And one way to think about our company and our services is in two key parts. We have an insurance company and a healthcare company. So we're both a payer and a provider, and that influences a lot of the decisions we make around our strategy, informatics, and AI specifically. So on the insurance side of things, we are a large diversified insurance company. We cover tens of millions of Americans. We have across many different lines of business. So Medicare, so health insurance for the elderly and disabled, Medicaid, health insurance for lower income individuals and women and children, TRICARE, health insurance for our active duty military and their family, commercial, so employer-based insurance as well, and then a number of specialty benefits. So a really diverse and large footprint on the health insurance company. This, again, motivates a lot of what we do. We take accountability for the health and well-being and affordability of healthcare for the tens of millions of Americans for whom we provide healthcare coverage. But we're not just an insurance company. We're also a healthcare company providing healthcare services to many of those members, but also many members in other healthcare through other healthcare insurers. So we have a very large primary care footprint, actually one of the largest primary care providers in the country, with north of 300 different clinic locations. Those focus on healthcare for frail, at-risk seniors and Medicare products specifically. We have a large home health footprint through a partnership with Kindred at Home, the largest home health provider in the country. We have a large pharmacy business where we think about how do we structure pharmacy formularies and affordability on the pharmacy level and help our members have access to and take the meds that keep them healthy. We have a large and growing focus on social determinants of health, knowing that a lot of what happens that dictates the health of our members happens outside of the clinic, outside of those 20-minute visits with their provider or their interactions with us as their health insurance company. So building really deep relationships in the communities where our members live to influence their health and for the better when they're outside the walls of the clinic. And then we're doing more to stitch that all together. And so we think about how at the enterprise level with all of these different services on the insurance side, on the healthcare services side, do we stitch it all together in to the member and to our members, a seamless experience where they don't know that they're bouncing between these different parts of the company. And that is a large part of where data analytics comes in. And Brent will talk through more of the specifics, but I think that helps give a sense of the scale and really what's at stake when we think about digital health and analytics and predictive modeling. It is guiding consequential decisions for our members. It's targeted at improving their experience, improving their health, making sure they get the healthcare services they need in an effective and efficient way. And that's why we care so deeply about AI more broadly, but specifically around fairness and equity in AI. As an enterprise, we have a really deep commitment to equity and fairness across all levels. And we think about this influencing our relationship with all of our stakeholders. So we are deeply committed to equity for our members, making sure that regardless of their race, gender, ethnicity, socioeconomic status, that our members are achieving the best health that they can. We think about it with our provider network as well. Those individuals that are really the front line working with our members to achieve their best health, or the providers we employ and work more closely with as a healthcare services business, making sure that that provider workforce represents the diversity of our members, and also that they're engaging with them in an equitable and fair way. We view as a large organization, large health insurer, we view our role not just for our members, but for society more broadly, and thinking about how we can use our position to influence and advance a more fair and equitable healthcare system and society more broadly. We apply this lens when we work with vendors. Think about making sure that our vendors are representative and that their practices embody the same level of commitment to equity and fairness that we do internally. And I think Brent may touch on that a little bit as it relates to our partnerships and vendors on the analytics front, and of course our associates. The only way we can serve our members and our other stakeholders is with a engaged, healthy, and well associate base. And so those same principles of diversity, representation, equity, fairness, and engagement permeate or really start at that level. Our commitment to equity, specifically around our members, is rooted in persistent health disparities. We are a healthcare company. This is what we care about. We are out here, we are working to deliver superior health outcomes to our members. And we know as a nation, at least and historically, that there are deep and entrenched health disparities where our non-white and non-affluent members typically, and again, a society at large, experience worse health outcomes. So a couple of motivating statistics here, many likely familiar to you. We know that I think this has been, unfortunately, COVID pandemic has really shown a bright light on these inequities. And just one statistic here, if you look at the likelihood of individuals to contract COVID, which is not presented here, but also to die from COVID, just really unacceptably high rates among Black, Native, and Hispanic Americans as compared to white Americans. We know that outside of COVID, this is not just a COVID story, that Black Americans are 23% more likely to die from cardiovascular disease than white Americans. And it's also not a story just of race and ethnicity, although those are often the dimensions that we see some of the most persistent and severe disparities. But again, socioeconomic status playing a significant role. We see the gap in life expectancy between the richest and poorest 1% of Americans is greater than 10 years. So a lot of room to move and a really urgent need to address some of these disparities, and I think has become painfully more clear in the last year with the COVID pandemic. So it brings us to the topic today around algorithms and health equity and the intersection therein. I think as we think about our investments in digital health and analytics and more predictive analytics, it is driving a lot of what we do to address the health of our members. But we know and we're concerned and need to be attentive to the fact that they are used as a force to promote health equity and that there aren't unintended consequences that might perpetuate or further existing biases in the system. And we have reason to be pessimistic. I think we also have reason to be hopeful. And so maybe start with the bad. So I think it's become increasingly clear over the past decade and even more recently over the past couple of years that without proper attention, we know algorithms can exacerbate existing health inequities. One way to look at this is just the sheer amount of research in the biomedical literature focused on algorithmic bias. This is a growth in the number of publications, and again, in the biomedical literature focused on algorithmic bias. It'll say the vast majority of these have a negative valence to them, or about times when algorithmic bias is leading to poor outcomes or identifying algorithmic bias, not so much about how algorithms can undo or reverse bias. And so there's a growing awareness, and there are many key examples along this curve of publications that have really called our attention to the fact that algorithms are already and have been perpetuating bias in some case examples, and also really shown the numerous ways, really often I think predominantly unintended, in which algorithms can perpetuate health inequities. One prominent example research I was involved in a couple of years ago prior to my role at Humana was around a population health algorithm that predicted total cost of care being used to allocate care management resources, led to unintended bias and preferentially not enrolling Black and Hispanic individuals, or at least having healthier white individuals have access to care management, or skipping the line in front of sicker Black and Hispanic individuals. And we'll come back to that paper towards the end of my remarks. So I think what I take away and what we take away from this is that what maybe was more theoretical concern among some in the AI and computer science space at the beginning of the 2000s is no longer theoretical. We know that that algorithmic bias is impacting is impacting health and has in many ways that are probably not yet uncovered, and that it's incumbent upon us to act proactively. I'll say there's also some good to the story. There's some reason to be optimistic. As we learn more about algorithms and health equity, not only can we take steps to ensure that they're not exacerbating existing health inequities, either making them worse or just failing to ameliorate them, but actually with proper care and attention, we can use algorithms as a force for good. We can actually redeploy them to explicitly ameliorate health disparities. And an interesting example of that from the literature earlier this year was a group that looked at using machine learning, image processing to actually better understand and better assess pain from osteoarthritis, so from knee osteoarthritis in underserved populations, and that actually clinicians are not particularly good at sort of understanding and assessing pain in that population. We know there are just persistent disparities in the assessment of pain, which leads to downstream treatment decisions. So you might be less likely to get a knee replacement, or less likely to have another procedure that would help you get back to health, get back to a higher quality of life. And actually, by taking humans out of the loop in a way, and by training a machine learning algorithm to sort of take what the patient said about their pain and look at their X-ray, they were able to reduce some level of the disparities in treatment and assessment of pain in this population. So one small example, but I think it is in and of itself meaningful, but also points to the fact that if you come into a research question or a system design question with a mindset of fairness, with the goal being to address and reduce disparities, you can quite easily and quite readily deploy AI and deploy algorithms as a tool to achieve those ends. So it's not all bad. Switching gears a little bit from context and motivation of why we're here, why this conference is being held, why we care about this as individuals and as a company, to our approach here at Humana. And I'll start this off and then hand it over to Brent to dive into some of the specifics. So part of the reason that we care so deeply about it is our commitment to equity, the scale of the problem as we see it, but also as I alluded to before, just how deeply AI and predictive analytics is embedded into the work we do. Here at Humana, we have about over 300 algorithms in production. Those algorithms inform over 1 million member touch points every day, with applications that span from marketing to clinical programs. And so, the scale and scope of AI here requires us to have a deliberate and structured approach to algorithmic fairness. So to start with our AI principles, and so this is work that's been done over the past several months to years to just better define and elucidate what exactly we mean and care about when it comes to the ethics and responsibility around AI. And we rooted this with a very clinical notion. So I'm a physician, and I took the Hippocratic Oath when I finished medical school. And the first line on the Hippocratic Oath is first do no harm, and that's what we wanted our AI principles to connote as well. The goal here is for AI to be a force for good, as I laid out, and not a force for harm. And that notion of first do no harm, it permeates a lot of our work in the ethical AI space. These principles, you see them on a slide, they might be easy, they might look like they're easy to get behind. Maybe for the audience here, the things that you're a little more familiar with. I don't think anything here is out of the ordinary. I think what was unique here, and Brent will go into this as well, is the process. Is getting, maybe among the data analytics, computer science community, this has become a more common notion over the past 5 years. But the work here was really about getting this in front of the C-suite, getting this in front of every single stakeholder at Humana, our board, our C-suite, those individuals who not only create and deploy algorithms, but honestly, more importantly, sometimes those that are on the receiving end, those that are putting the algorithms into action. And so by really unifying and ratifying these principles as an organization, we increase the visibility internally around the importance of this issue and achieve the buy-in necessary and got a significant amount of mind share among our leaders across the organization. Again, Brent's going to touch on some of the specifics here, I think very relevant to what I'll discuss next, and some of the work here is around fairness and inclusivity, but all principles are kind of held to an equal standard here and permeate all the work that we do. As an organization, we've also publicly committed to fair and inclusive AI. We're the first health plan to take the Equal AI Pledge, which is just meant to be which is rather a public commitment to what we've been doing for some time internally, to really to acknowledge that a bias in AI happens, and without dedicated and explicit attention, will continue to happen. And unless we are actively auditing our algorithms and proactively looking for bias and then addressing it if we see any, we won't take ground against this issue. And so this is just a formal pledge to do that, and really, again, solidifying some of the work that has been done internally. So I'll end my remarks with, I'll bring a little more color with a case example of how these principles are put into practice. So I alluded to a study that I was involved in a prior role earlier in the talk around an algorithm that found, our assessment of an algorithm, a population health algorithm that found racial bias in terms of how care management resources were allocated. And we'll take this through kind of from publishing to practice, how we as an organization look at and digest the literature, stay on the leading edge of what is coming out in this space, and then translate that into policies and procedures and approaches to the FAIR AI internally. And so for those of you that are not familiar with this study, the root cause of the bias in the study was actually a label choice issue. Was that the algorithm was predicting costs, which it actually did in an unbiased way. There was no racial bias in its ability to predict costs, but it was being used to allocate care management resources based on healthcare need. So it was, developed and trained and validated with one outcome, with one label, cost, but was really being used, they were using cost as a proxy for healthcare need, at least in some implementations of the algorithm in the health system we studied. And that's what led to bias, because it turns out that cost is a biased proxy for health because of structural inequities in access to care, chiefly. And so when we think about taking what we learned from that study and other studies and the emerging literature in the space, here is kind of a case study of the steps that we take now as an organization to avoid similar sources of bias. So it all starts with assembling a diverse team, and that is diverse in every sense of the word. It is diverse in the age, gender, racial, socioeconomic, the background of the team members itself, making sure that we have representation from important protected classes. But it is also a diverse team in terms of the business function. So we want at the table those that are the business unit owners that might be using the algorithm or maybe asking for the algorithm to be developed, along with data scientists who will be creating and validating the algorithm, along with our colleagues from a kind of legal and regulatory perspective. Need really as many voices at the table as possible. And I think we know that some of these issues, especially around label choice, if you just ask the right questions from the outset, in that case, if you would have asked maybe, is cost a biased proxy for healthcare need? We know that's the case. And so if we had the right folks at the table and we're asking the right questions at the outset, we believe we can avoid a lot of these challenges. Relatedly is this notion of investing in problem formulation. And this is being very clear and explicit about what we are trying to predict. Often we have to use a proxy. We can't predict. We don't have a variable in a data set that is exactly the thing we want, and we're forced to use proxies. But it's always worth pushing and interrogating on whether or not that is absolutely necessary, and if so, what the right proxies are. And again, this is where having a diverse team that is understanding of the structural inequities that might be baked into data, the structural inequities that might be reflected in the choice of one proxy versus another, and then a deep understanding on how the algorithm is going to be used. When you better understand how it's used, you can better understand if the proxies are efficient or inefficient, if there are other ones out there, and obviously have a sense of the any downstream bias in terms of how individuals might be treated. Of course, the next step was to audit for bias, and of note here with the right metrics, depending on the implementation of the algorithm. Even the same algorithm, if you're using it for different purposes, you might be looking at a different fairness metric or different bias metric. And I think Brent is going to speak to some of that as well. Our approach now to really have automated a large part of this process when it comes to auditing for bias. If bias is discovered, the next step would be to test debiasing techniques. And then finally, when we're comfortable that we have an algorithm that has the correct labels, is predicting what we care about, is being used in the right way, is free from bias or has been debiased, only then our algorithms implemented and scaled. And this is also a circular process. What's not here is the continuous learning. So it's not implement and forget, it's implement and monitor, implement and track, ensure that there's no drift over time that might actually cause bias down the road. So we're continually monitoring algorithms that are in production for bias. If the algorithm's used for a different purpose, we really have to go through this process again. And then also just, as we learn more about how these algorithms are used, making sure that many of the assumptions perhaps that were along the way in this process are validated. And with that, I will turn it over to Brent to continue.
Thank you, Brian. I'll share my screen here. All right, so I want to talk about how to actually create an AI ethics program, because I think it's something that is quite large and can be very, very overwhelmingly, especially at an organization as large as Humana. And it really is, as Brian had mentioned, it's a cycle, because AI ethics is something that's evolving, it's changing, and the program really should be set up to do the same. And really, it all starts with the business support. And the business support is really a key piece to it, and that will lead into building the guiding team, which will help and really drive the vision for what the program is going to look like. Then from that vision, you can empower the team who then executes on that program. I'll just go through this in some more details. So first, what are some of the key elements here? So first is really need to be sure that you're capturing the requirements for the program. What is going to be part of it, how central to your organization are AI algorithms and data science algorithms, and from there, how also can you fit in mechanisms for enforcement, and what business partners can you include, should you include in the process? So first of all, any of these changes really require a very high-level strategic alignment and a diverse team. High-level strategic alignment is really key towards having an effective program, because there's often going to be consequences for the business stakeholders who are using the algorithms that they're going to need to really be aligned with, because there's going to be consequences to it. Any sort of governance program like this is going to have inherent slowdowns. That is kind of the fact of the matter, because it's essentially like having tires on a car, and those tires might add some friction, but what it does is make sure that you stay on the road and ensures that you're driving safely. And it's the same here. What we really want to make sure of is that the business is aligned and understands all of the negative and positive consequences of the program, and so by slowing down, they can ensure that there's no harm, that there's going to be no unexpected consequences to the work that they're doing, and really getting them bought in and really excited about the program is key, because really that excitement is from the top level is going to translate down into action at the stakeholder level, the people who are actually going to be consuming the AI and the models that are being built. But additionally, diversity is key here, I think, more than anywhere else. Diversity is something that I think is just a critical piece to any business. But when you're creating a program that is really focused on making sure that there's equity, that there is equality where needed. It's important to have those voices be part of the conversation, because ultimately their experiences, their voices are the ones that are going to inform for potential harms for the communities that they represent. And as Ryan said, this goes across race, across age, across gender, across background, and having this set of voices is just absolutely key, because there's always going to be nuances to this that need to have that representation to fully encapsulate as much of the historical, societal, and other consequences that come from AI to make sure that everything is being accounted for. And from that, really, and from that diverse team, you can really start to look at the company values. So, for instance, at Humana, since we're a healthcare company, the Hippocratic Oath is kind of a natural driver for the decisions that we make, and AI is no exceptions. Here that it's not the same for everybody though. There's going to be other companies that might have a philosophy that's going to drive differently, but it's important that whatever philosophy is chosen is really following the values of the company, because that really makes it a lot more organic and much more natural to implement within the organization. So as a part of this, as continue on in the journey, creating some sort of a fairness framework, and some actual guidance to push towards that vision of fairness is really key, because especially in a company as large as Humana, we have hundreds of algorithms, and we can't have a meeting of a committee every time that we're going to have an algorithm, because it works out not to be practical. But what we can do is have guidelines for the most common algorithms that we produce that are going to guide 75-90% of what we do, and then handle the outliers. And really that sort of a framework can ensure that you have that diverse representation that is going to cover the wide array of cases, the most cases, but then be able to dive in where you need to on some of the more edge cases that are seen within a program. Right, and then as the program is being created or has been created, really communication is really key to this. Conversations around ethics and AI and diversity can often be very difficult, especially in a workplace environment. These conversations are quite difficult to have, and so when you're creating a space for this to be discussed, it's really important to make sure that it's a place that's going to facilitate safe and open communications, because often people are going to feel not very open about going against the flow, against the majority of people that are there, and may think that their position is going to be unpopular, and that could make them not share it. But it's important that they do, because that's really the linchpin of diversity, is to make sure that they feel open to share that point of view, and that they feel comfortable having a voice. And so having that open environment where folks feel safe to talk and share their point of view is absolutely critical. But another piece that is going to also really play into that even more is transparency. And so being open and building trust. And so this goes not just between the team who's creating it, but also with the stakeholders, and letting them know what the plan is, what they can expect, why you're creating the program. And that trust is really going to be key to adoption. And so not just in creating a program for AI ethics, but also to adoption in general, because the more that somebody trusts an AI, a model, the faster they're going to adopt it. But back to communication again, making sure that this is all communicated broadly and transparently. The technical stakeholders are going to be just as important as the business stakeholders to create that shared understanding, because really it's not just on the people who develop AI to make sure that it's fair, but it's also on the people that use it to make sure that they're using it in a way that was intended, and to help inform the people creating it of any of the caveats or specifics that could help to inform how best to implement it in an ethical way. So in order to actually implement something that's effective, it's really important to have some compliance mechanisms on there, because again, it is like tires on a curvy road. You need them, that friction to stay on the road. And so having high level goals for the program to meet, having gates for some of the higher risk models to go through to make sure that you are following the guidance and improving it as you go, are going to be critical to ensuring that it's an effective program. And then lastly, here, I just want to touch that AI ethics is an evolving field. The ethical principles don't necessarily guarantee an effective implementation. And so the implementation is going to be just as important as those principles. Any sort of program can't rely on a static framework because AI ethics is still moving and is moving quickly. It's important for the program to acknowledge that and have that built in. And from there, awareness really is pivotal to assure that no harm is done, and that folks are complying with it. But though talk about what we've done at Humana and what we think are our best practices, each company is going to be different, and any approach should be customized to match. So that is it. Thank you very much for having us.
Awesome. Thank you so much, Brent and Brian. If you could stop sharing your screen, I know the audience wants to give you a huge virtual round of applause. All right, for the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and check out our amazing AI exhibits. Thanks so much, and we'll see you around.